If you struggle with no-shows or cancellations, listen in for the 3 things you can do to optimize clinical buy-in so your patients show up for their sessions. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Today, I am so blessed to have with us Dr. Nicole Cozean. She is a pelvic health physical therapist. She's the owner of Pelvic Sanity in Orange County, California, and also Pelvic PT Rising, which is an online educational platform for pelvic rehab providers. Welcome to the podcast, Nicole. Thanks for being here.
Thanks so much, Lynn, for having me. I'm really excited.
Yeah, so, I'd say of all the PTs, I think you're the one that's doing it all. When it comes to running our
Trying.
business, you're doing a fabulous job of running your own clinic, teaching other PTs, and you're doing all the social media, you're doing podcasts, you've written a book. I mean, what haven't you done, Nicole?
Yeah, I know the other thing we added to the list was where I co-founded Pelvicon
I
last
know.
year. So yeah, it's actually been fun. It's a journey. It's actually really funny to see it all laid out like that because I don't feel like it's not like I set out and said I'm going to do these 17,000 things. It's just like it's been an evolution, and it's been really exciting to sort of see where my career's gone and all the things.
Isn't that fun as a PT? I mean, when I started out, I had no idea that I would be doing what I'm doing today. Don't you love the journey and the
Yeah,
process to get
same.
here?
Yeah, and I feel like the impact what I've found is that, I did struggle a little bit as I was realizing I couldn't do it all actually. So I couldn't see my 40 patient hours,
Yeah,
all the time. And then so I had to decrease that a little bit, actually, and quite a bit actually,
yeah.
in order to, do all these other things, but you're still having an impact for people. And if anything, it's actually multiplied in that way. And so that's actually been really a cool thing to really see come to light as well.
Yeah. Well, I know when I reached out to you about doing the interview for the podcast and also the Birth Healing Summit, I was just like in awe. I'm like, Nicole, how do you do it all? How do you manage it all? And I think your answer was really important here. And that
Yeah,
you have your husband helping
I
you.
have I have help, and I feel like I think it's so easy for all of us to have comparisonitis a little bit. Be like, well,
Yes.
she's doing everything and oh my gosh, look at all those things. And it's like a little duck, where I'm cruising across, but underneath it all, there's like a lot of people helping. I have a super supportive family. Jesse is my like right-hand person, both in life and in business. And we both do pelvic PT rising for business and clinical. And then he also runs the back office portion of Pelvic Sanity. And so together we've sort of done that. And so there's really two people doing it. And so, right. So it's a good lesson in making sure that you're comparing apples to apples too, you know?
Exactly, exactly. And I've been fortunate enough. I grew my PT practice, first, and then I started the Institute for Birth Healing, and I have the team with the Institute for Birth Healing. And once, I was kind of doing both, and then once COVID hit, I like stopped doing anything for my clinic and just focused on the institute. And now I'm just like in the last 5 6 months been like, okay, got to get that going again. Like
Yeah.
you cannot let any part of your business just kind of coast.
No, definitely not. And you have to decide, who's going to be the people to help you along the way to get it so that you're not just coasting, because otherwise you have to start over in a lot of ways,
Yeah.
with
Which,
marketing and all kinds of stuff.
well, which is where I'm at right now,
Yeah.
and but the thing is that I didn't, and I think this is for another podcast because we do have another topic we're going to talk about today.
Yeah. We
Um,
promise.
Yeah, but what I've always been concerned about being careful what I create, and
Mhm.
for my practice, I didn't want to create it any bigger because it was just me and I was busy enough. And when you have a wait list and so, but now I've got more therapists that want to come support me. So I want to build it bigger so that
Yeah.
because now I have the support.
Right,
And
exactly.
so,
Yeah, and the most important thing to I think to take away from all of this is that it's an evolution, and it's okay that it's not perfect or your at your end vision at the beginning, right? It's like we've both sort of evolved into where we currently are. So,
absolutely. Well said. Well said. Okay, so let's jump into our topic today for this podcast,
okay,
which is 3 ways to get clinical buy-in to help your clients or patients, however you um, determine how whatever you call your people
yeah,
that you work
your
with,
people.
your people, right? Okay, so Colton, how do we help get our clients to buy into what we want them to do?
Yeah, so I think we could take it one half a beat back and just talk about like the fact that we all need to understand that as pelvic rehab providers, as pelvic health practitioners, that we can't help people unless they're coming in and seeing us, right? If we have an in-person business, they have to be there. Honestly, even if you have a virtual business, they have to be interfacing with you in some way. And so
So
where I feel
showing
like,
up, right? They have to show
yeah,
up.
they have to show up in some way and they have to like pick up what you're putting down, right?
Yep.
And so what is interesting, especially when you're working for somebody else, for people that haven't started their own business yet, the current system doesn't teach us to prioritize that fact. A lot of times people come from a place where they're handed clients, right? It's like, and if somebody drops off or falls off, you have somebody else filling that slot. And it takes a very special person and with an entrepreneurial brain to be like, hey, what happened to so and so? And so a lot of times, we actually are primed to sort of not care about that. And then all of a sudden we decide to go out on our own, we open our own businesses, and then we are very rudely awakened by the fact that we do have to care about that, and people can't get better unless they're actually showing up for us. And so what does that look like for us? And this is where I love talking about the intersection of where clinical buy-in meets growing your business, because those two things go hand in hand. um, One of the other things that I think people assume a lot is that when they open their business and they're seeing some sort of challenge with clients coming in and showing up and or dropping off, that we have a marketing problem. Oh, I just need to get more clients. And when you look at it from the business perspective, a lot of times we usually don't have as big of a marketing problem as we think we do. What we actually have is a clinical buy-in. We're not doing as great of a job optimizing the journey of somebody that has already come in and made contact with you at your clinic. And so that's what we're going to talk about today.
Okay.
So,
So how do we do that?
um, yeah, so how do we do? What do we do? So I feel like that step one is identifying all of those things. Is this actually happening to you? Right. And so we're going to talk about 3 ways that you can sort of make sure that you are 3 things that you can make sure that you're doing in every session and with every client or patient, to make sure that you're optimizing that clinical buy-in. So number one is
Okay.
that we need to be using, and this is hard for us because we're such public health nerds, patient-centered language on what you think is happening and what you found to be related to their symptoms. So I want you to put yourself in your patient's shoes or your client's shoes. They're coming in with some sort of pelvic health concern. They're looking to you for your expertise. And if we are all of a sudden going into clinician mode, and we get excited. We know we can help them. We have this pelvic thing that we see. We've got pelvic floor muscle assessments. We've got anything that this nerve is bothering this muscle, all the things. But if we can't relate that to what they're coming in for and in patient-centered language, then in a very succinct way, not giving them a laundry list of 18,000 things you found on your evaluation, but what are like I usually use the top three. What are the top three things we've found today that is the reason why you're in here? And the key is using patient-centered language. So we there's I need you to figure out like what are your little analogies that you use, all kinds of stuff like that, so that you can connect with them on a level that they're going to understand and that they'll remember.
Right. So important.
So for instance, like, if we're talking about like a pelvic floor muscle that's irritated, um, versus a nerve that's irritated or something, one of my old people that used to work for me said this amazing thing, right? She was like, muscles are like dogs, nerves are like cats. Right. So when we're working on a
That's
scared cat,
great.
so when we're working on these muscles, isn't it right? That's going to stick with people's brains now. So
Absolutely.
when I'm working on a muscle, we have to work on it a certain way. When I'm working on a nerve, we have to be a lot more like, cautiously moving around that area. We don't really want to poke that nerve too much. Otherwise the cat's going to hiss and get pissed off. So things like that, like when we're presenting what's the matter to the patient that we've seen, how can we show them and get them to like understand what's going on, but in patient-centered terms or little analogies like that. And that will actually help your client to buy into more of what you're doing, right? Because they're going to remember what you said. They're not going to remember that their pubococcygeus is irritating the left side of their pudendal nerve, right?
Right.
They're going to remember that I have a muscle problem that is irritating a nerve, and that nerve is like a cat, and we have to be a little bit cautious about how we approach that nerve, right? We can get it to calm down, but we got to be a little bit cautious about that. So whatever. So but you just kind of get my point, right?
Absolutely. I'm just thinking of all the anatomy terms, right? The levator ani muscle, your coccygeus muscle, and all those names, whoo, right over our clients' heads.
Right.
So
And even saying something like, the tailbone, this is your tailbone, this is at the end of your spine. This is why this little thing right here is why and look, it's attached to your back. So this is why your back pain might be influencing your pelvic floor, and you can show them on there, right? So it's not saying your coccyx is hyperflexed at this sort of angle, and that's what's causing your lumbar spine to be, it's much more simple than that. And I think a lot of clinicians struggle with saying things like that because it's not 100% accurate, right? It's not 100% exactly what it says in Netter Anatomy. And
but
that's
what we have,
okay.
yeah, we have to be careful that we're not talking over our clients' heads. And so,
Yes,
yeah, so I love that point. We shouldn't be talking over our clients' heads because then they're gonna leave confused. We don't
totally.
want
And
them,
not remember.
yeah, and then they're not gonna, understand the importance of what we found too.
Exactly. And that's a perfect lead into number two, which is I want you, when you're thinking about clinical buy-in, to think about, I want you to be able to outline, again, in a relatively succinct way, what it's like to work with you. What is the progression of the journey of what it is to work with you? For me as a pelvic floor physical therapist, I have a specific way of talking about that there's 4 phases of treatment. And so I outline for those patients and clients like what it's like to work with you. What happens in phase 1? That's where we're figuring it out. What happens in phase 2? That's where we're addressing all of the things we just found. Phase 3 is challenging. Phase 4 is being on your own, still guided, so they can kind of see the path.
I
if
love
we if we only talk about the first couple of visits, or we're allowing them to fill in a ton of gaps that might not be accurate for either how long something's going to take, how short something's going to take. And so we really need to make sure that they understand, in my instance, Pelvic Sanity, which is my brick and mortar clinic, this is what it looks like. And also making sure that we don't have to say how many visits that is, right? We have other ways of signposting to them what it's like to be successful here. And so I think that if we can help them to see and lay out the path, give them the roadmap, and then tell them where we're going to be going, then I feel like that can also be huge with your retention and the buy-in initially. And then they're not going to necessarily cancel their third visit because we're still working on this one part, right? So it really gets them to sort of understand like the path. And that's really, really important.
I love that. I love that. I mean, everybody wants to know where they're going. And
Exactly.
the fact that you're explaining how you're going to help them to get there is huge for their buy-in. That's excellent.
Yeah, and the other thing is for our clinic especially too, especially if you're in the wellness space and you believe that we have a place in our patients' journeys beyond just symptom resolution, that's also where for us, the symptom decrease is half the journey, is only half. Then then in phase 3 and phase 4, we're in a less symptom state while we are now working on optimizing, right? So now the patient understands that they're not just going to stop right when they start to feel better. We have some more work to do, type of a thing. So
Yeah.
that's number 2.
Okay.
And
What's
then the last one is probably the most simple, but I think the one that we forget to do the most. And that is, I want you all to make sure that you specifically tell them early and often that you're in the right place, I can help you, and we have a plan to figure this out together.
wow.
Like
That's huge.
the
Got the
it's
chills.
because we forget. I think we get so excited with all of our pelvic health nerd knowledge that we just forget to just be super simple with you're in the right place. Like I've seen this before. I
Yes.
can help you. We've got this. I've got you. We're gonna do this together. And people, remember, don't retain very much information from when we're talking. I think there was I don't know if it was a study or whatever, but in general, people retain like 10 to 20% of what they hear, right?
Yeah.
And so we need to make sure that we're pausing in this state and saying like, I can help you, because if that's the only thing that they remember, they're going to make sure that they come back then.
Awesome. That helping them to feel that support from you, right?
Yes.
And
Yes.
yeah. Oh, that's an awesome message that we need to make sure we get through to our clients
Yeah.
for
And
sure.
I'm talking like physically say those words, like not just think them with your heart, not
Yes.
just like really feel them, not the vibe of your clinic, but actually physically say those words to the person in front of you can be so powerful. And then now, if we do all of those things, now they understand. And number one, they understand that what their issue is and how it's related to their symptoms. They're going to remember it because you've come up with some really cool ways of explaining. You've outlined for them now what it's like to work with them and what it's like to be successful at your practice or clinic. And then you've reminded them that they're in the right place, that you can help them. That is really hard to say no to. That's really hard to prioritize something else above. And so then that's how we can get that clinical meets business buy-in. If you can do that clinically, then you're going to get your client and patient coming back to your practice, and then having a successful outcome. And then now we are having a good review, and all the things can help that grow your business. And it all starts with being clinically present and helping your patient to see that clinical buy-in.
Right. It's taking what we know in our head and getting it out of our mouth in a way that our clients can fully understand it and hear it. So
Yes.
they're going to be coming back. Oh my gosh, Nicole, that was just huge, 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 huge. 3 very clear steps that we can all implement today. And I'm so grateful for you for sharing that. You actually have a gift for us too that
Yes.
I can download in the show notes. So tell us about that real quick.
Yeah. So what this is basically like if somebody's listening to this podcast and they're like, gosh, I'm not sure. How do I know? How do I know if I'm getting good clinical buy-in? And we have a downloadable self-assessment for you. It is 5 little questions that you can answer to see, is this something that you need to work on? My guess is that no one's perfect, and that yes, there are aspects of it that can be improved, but it can help you to see where you might want to start this process to get this dialed in a little bit better for both your patients and clients and your business.
That's awesome, Nicole. I'm going to have to check that out because yeah, even, I've been in practice for over 30 plus years and I think I could improve on those 3 steps as well.
Yes,
So
100%. It's always a work in progress.
right. Yes, such great information, Nicole. Thank you so much. Any parting words or tips that you would like to say before we say goodbye to everybody?
No, I just want to actually, well, yes, one thing I will reiterate that this is important, right? I'm going to say the same thing we said at the beginning. This is important because if our patients and clients are not coming into our clinic and working with us, then they can't get they can't get the care that they need. And so we need them to understand this. And it's our job to communicate this with them in a way that they're going to understand. And then everybody's happy and our business is then thriving.
Awesome. Oh my gosh, that is so well said, Nicole. Thank you so much for sharing those 3 pearls
Yes.
of wisdoms with us today.
Well,
I
thanks for
hope
having me, Lynn.
Yeah, thank you. And everybody, please put those 3 steps into practice and let's get your businesses thriving. Let's support our clients in really getting the full care that they need in getting better. So thank you, Nicole, so much. Thanks
Yeah.
everybody for listening in. And please check out the downloadable gift that Nicole has in the show notes. And we will see you all on the next episode. Thanks, everybody. Bye-bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To learn more, visit instituteforbirthhealing.com. Use podcast 50 to receive $50 off of any online course.